Good evening and welcome to my channel. My name is Faith and I welcome you this evening once again on another video. For those who are new here, I welcome you, and those who have been here for some time, please, I welcome you again. Today's topic is about nursing associate. I told you some time back that I am a nurse. I am a nursing associate, and we are going to look at today the roles or the duties of a nursing associate. First of all, before I come to you, I will make some research. I will use the knowledge that I studied from school, and I also go and look somewhere else to find more information so that I can give you something which is perfect, something which is good, and to help us to learn. This is not just for me, it is for everybody, it is for my viewers, it is those who are aspiring to become nurses, nursing associates. So, when you see me, again, looking at my iPad, don't be surprised. It is just the content. I type it, I take time and organize it. I type it in Word document, and then afterwards, I take a photo using my iPad, and then when I'm delivering, I read everything perfectly so that it can come out perfectly so that other people can learn. Okay, we are beginning. Who is a nursing associate and what does a nursing associate do wherever they work? Nursing associate is a new role within the nursing team. Nursing associate work with health support workers and registered nurses to deliver care for those patients and the public. It is also a stepping stone to become a registered nurse. So, if you are a qualified nursing associate, you can add on if you want and become a registered nurse. So that is a nursing associate. Nursing associates work across all 4 fields of nursing: adults, children, mental health, and learning disability. Your skills and responsibilities will vary depending on the care setting you're working from. There are many different care settings where a nursing associate work. These include hospitals, care homes, domiciliary care, and daycare homes. So those are the places, and many others. Those are the places a nursing associate work. Now the next step, we are going to look at the role of a nursing associate. What does a nursing associate really do wherever they work? First, undertaking clinical tasks including venipunctures and ECGs, stroke electrocardiogram. Supporting individuals, their families, and carers when faced with unwelcome news and the life-changing diagnosis. Performing and recording clinical observations such as blood pressure, temperature, respirations, pulse, blood sugar, weight, and many others. Discussing and sharing information with registered nurses on patients' condition, behavior, activity, and responses. Ensuring that the privacy, dignity, and safety of individuals is maintained at all times. Recognizing issues relating to safeguarding vulnerable children and adults. More to that, we administer prescribed medicine. When a doctor prescribes medicine, it is our responsibility to supervise the taking of the medicine and administer it. A nursing associate will also dress wounds, depending on the kind of wounds. There are so many types of wounds, and a nursing associate will dress wounds because you have been trained to dress wounds. When the wound is more than she can handle, we normally report it. I'm just saying she, but there are also he. There are many she's and he's. Men and women work as nursing associates. So I was saying, if a wound is big, it's complicated. It's for a nursing associate to handle. We normally report it to the registered nurse, and the registered nurse will come and cross-check and see or examine and see the status of the wound, and then guide us accordingly. If still it is beyond her control, she will also report it to the doctor and see what we can do, because some wounds, they can become chronic. Some wounds may need surgery. Some wounds may be so infected that they need more attention, or change of dressing, or change of medicine. So that's why we handle wounds like that. I like handling wounds, by the way. When I take care of a wound and I see the process and I see it getting better, I feel good. I feel satisfied. We guide, direct, and help patients with the use of guides. Guides including wheelchairs, walking sticks, hoists, and many others. People come in the hospitals and they don't know if they are going to ever use wheelchairs or any kind of support or support or sorry. Or AIDS. I'm very sorry for that. And by the time they leave hospitals, they need these aids. So it is our duty to guide them, teach them how to use them, teach their carers, the people who take care of them, how to use these aids. Sorry about that, but that is one of the things that we do. We support independence. Every person wants to be independent. People want to do things by themselves. So as we take care of patients, we encourage independence. We encourage them to do certain things by themselves. So we help them where they cannot help themselves and give them to do certain things by themselves. Thereby then we are encouraging their independence. And by the way, when a patient does something for themselves, something that they were not doing before, and they do it by themselves. For example, if someone has not been walking and they, with our help or with our support, they begin doing things by themselves, they feel happy. they feel encouraged, they feel like they have achieved something. So that's why we encourage independence. Another thing that we do, we take care of openings. But when I talk about openings, some people may not understand. Maybe they have never seen them. So, due to some sicknesses, the big intestine sometimes can get problems, and it cannot help a person in a defecation. So the doctor will open the stomach and then cut that piece that is infected or destroyed, and then they help a person or a patient to defecate from the stomach here. So there they put a bag. So that is the work of a nurse or a nursing associate, to make sure that that place is clean, that the bags are changed accordingly, or if they're not changed, we empty them. So that is another responsibility of a nursing associate. We clean and take care of cystophics. What are cystophics? Cystophics, those are openings on the stomach to help pass out urine. The doctor will open this, the stomach, and then the opening goes up to the bladder, and then the doctor will put a catheter tube that will help pass out urine. So it is our responsibility to make sure that that opening is cleaned and maintained, kept clean and covered. And we also make sure that the urine is flowing properly through that tube to the catheter bag. Yeah, that is another responsibility that we do. We also do catheterization. By catheterization, we use disposable catheters. Disposable catheters, we put them inside a patient and we help them to remove, we empty the gallbladder. So we are all trained to do that, and we do it nicely, and it doesn't pain, it just does its work, and that is it. So that is another thing that we do. By use of pegs, we give medicine and food to the patients who cannot eat anymore. Some people, they have openings maybe in their throat or here, so the upper stomach. So the nursing associate will use pegs to give this patient food so that they can feed, despite the fact that they don't use their mouth anymore. Maybe you have not seen it, but it exists and we do it. We also take urine samples. Sometimes the doctor may want to know if a client has a problem in their urine or something. So we take urine samples and take them to the laboratories, and then after they are checked, we find out results of if the patient has something in their urine or something like that. So it's another work of a nursing associate to take urine samples. We also give injections. We give injections such as insulin injections. We give injections. We also help to dress or put surgical stockings and bandages to clients who have problems with their legs. Sometimes the legs will lose support, they cannot support the the pumping of blood that pumps from the legs back to the heart, so, and from the heart to the legs. So with those patients who have such problems, we hope to put surgical stockings and bandages, and they get support, they get help, so they get that flow, the blood flows and is pumped from the heart to the legs, and from the legs to the heart, back to the heart. We also receive and register patients. Patients, they keep coming to and from health centers or care centers like hospitals, care homes. So the nursing associate will receive the new patients and register them and find them places to stay. And also, if patients are going away, maybe from the hospital, they are being discharged, we also take care of that. We make sure that they have everything, that they have all the medicine, all the records, and everything they need. We do that. We also receive their visitors. We help them to see their patients. We handle all those issues. We also call ambulance for patients. It's where there is emergency. For example, those if you're working at a care home and you discover that the patient's condition is getting worse, and ambulance needs to be transferred from the care home to a bigger hospital, we will call in the ambulance, and the ambulance will take the patient to a bigger hospital. Also, if you work, maybe you work in at domiciliary care, you get a client's house and you find that the client situation is worse, or there has been an accident and the patient is in a bad condition, you're going to call an ambulance, and then the ambulance will take care of the situation. Lastly, that I'm going to talk about is our pay. How are nursing associates paid? We actually paid very well. Me, I've never complained about my salary as a nursing associate. We are paid very well, and that is the kind of salary that really will motivate you to continue working. I'm not saying that we work for money. Yes, we work to get money, but we also work from our heart. But our pay is very good. I'm saying this in order to motivate those people who haven't joined our team, who don't feel like studying anymore, to come and join us. They give us, before they cut off, before you pay your tax, your salary may be around 2,000, 2,200, depending on where you're working, and many other benefits. In my opinion, that salary is really good for a nursing associate. But if they give us more, it's not very bad. It's not bad at all. But please come and join us. We are paid very well, and I'm proud of that. Yeah, I think that is what I had for today. Hope this will help those who would like to join our team, those who would like to join us. Before I continue, I'm taking some coffee actually. I love coffee. I drink coffee a lot, so I'll not forget taking some. And today we will end here, and then I request you to press that thumbs up button if you like this video, and please click that notification bell so that you get every new video that comes up. And lastly, please subscribe on my channel. This will help the channel grow. and it will make me happy. Thank you very much for listening to me, and please stay around for more videos. Bye bye for now. Cheers.